Hey guys, welcome back to my channel. In today's video, I kind of wanted to let you know how life has been working in the clinic. So, as you know, I am an MFM sonographer, and I have been learning a ton. And I mean like a ton. It's kind of, I feel like I'm back in school, honest to God. But as an MFM sonographer working in the clinic, now you can work on the hospital side, but I work in the clinic. As the way my day goes, I get there a little bit early because that's just who I am. Like I drop my kids off. I like to be work early so I don't feel rushed because it eliminates quite a bit of stress for me. So that's nice. But anyhow, I get there at 8 o'clock. And I say 8 o'clock because that's what time our day starts. So when I get there, I just clock in. We go by a magnet system. It kind of tells it keeps us in order as far as what our exams are going to be for the day. In our clinic, we have a pretty busy clinic. So we see in the mornings about 50 patients. And I'm going to say 50 just to kind of like either give or take a few. But for the most part, we see about 50 patients a day in the morning. And then the afternoons are usually a little bit lighter, but we're about 32 patients in the afternoons. I'm telling you what though, New Year's Eve, we had a ton of patients and we started our day at 7 a.m. and got off at 1. So, I mean, we saw a lot of patients in that day. But with that being said, it's not like there's only like 1 or 2 of us. We have a pretty large staff. They said hasn't always been like that, and that it used to be like really busy. But for us, what I've seen since I've been there in the past 6 weeks, and I say 6 weeks because like my first 2 weeks were just a couple days here and there, but I've been there for a full month now. And I'm actually doing a whole lot of scanning. When I first started doing it, I wasn't scanning a whole lot. I was doing a whole lot of observing. But anyhow, there are usually about 8 to 10 sonographers on staff for the day. We have 2 that take call, so sometimes they'll get called in or called out and they'll have to go downtown or up north. And so they'll have to end up leaving our clinic and then going into helping out at whatever hospital calls them in, and they'll sometimes come back depending on how busy the other place is or not. But like I said, there's usually like 8 or 10 of us. And then there's 2 of us that are brand new. So that's kind of cool. At least I'm not the only new person by myself. But anyhow, when I get there, because I'm early and one of the first ones there, we usually get the very first patient. So what the magnet system does is you put your magnet on board at the top as soon as you get there. And as everybody comes in, they put their magnet on the board underneath. So when you get a chart, what happens is the MA or the nurse will put the chart on our board and then ring the bell, and we'll go get the patient's chart, move our magnet to the side, and do everything with that patient's chart, meaning whatever we need to type in the chart, reading the chart, and then going and scanning the patient. Once we scan the patient, we come back, move our magnet to the bottom of the line or list or whatever, and then we finish writing up the chart. Depending on how busy we are, we may have quite a few patients before we see another patient. Or we can be kind of short-staffed and have a lot of patients, and then like as soon as you put your magnet up there, you gotta hurry up and turn that chart really quick. One, you want to be pretty quick at turning the chart anyway, so that way the doctor can get it and go see that patient. But it goes really quick, and you're back to seeing another patient. In the MFM clinic, we do multiple scans for patients. But with me being new and in training, I've done a whole lot of growth scans. So basically every 2 weeks or whenever the doctor says that this patient needs to do a growth scan, excuse me, we'll basically measure the femur, which is the long bone in the baby's thigh. We measure that twice. If the measurements are coming up pretty even, about the same each time. You only have to measure it twice. But if you like, for instance, if like your first measurement is completely off from your second measurement, definitely you want to take a third measurement, and that goes with everything that you measure. We measure, this is called, so with all the measurements, you'll measure the femur bone, the abdomen circumference, you'll measure the humerus, which is the long bone right here, and then you'll measure the head. And so you are basically, what you're gonna do is it's gonna average all those together to give you an estimated baby's weight. And it's gonna tell you about how much baby's grown since the last time we did a growth scan. So I've done those. I also have done BPPs, so that's the antenatal testing. What that means is a BPP is, it's a score of 8. So for each thing that you're looking for, when I go in to scan for a BPP, I instantly check to see if baby is cephalic or breech. And I document it, take a picture of it. Then I check the mother's placenta, make sure placenta is not tearing away from the uterine wall. I make sure it's got adequate blood flow, and then whether or not the placenta is posterior or anterior to the baby. Which means whether the placenta is on the back side of the uterus where the baby's it's behind the baby, or if it's on the front side of the uterine wall, which means it's gonna be like towards the mother's stomach and in front of the baby. After I do that, then I scan for the AFI. Basically, I'm checking to see how much amniotic fluid is around baby, because you don't want the baby to have too much fluid or not enough fluid. So you're gonna measure 4 pockets on the mother's 4 quadrants. So right upper quadrant, left, lower, lower, on all 4 sides. So your 4 quadrants, okay? You're gonna make sure that baby's got plenty of fluid in there. Then, right away, because a BPP, you should be scheduled about 30 minutes to do this test. You go ahead and look at baby's abdomen and see if their diaphragm is moving up and down, to see if they're practice breathing. That counts as 2 points, okay? Then you have fetal tone, which basically flexion, tone and flexion, okay? Then you have, that's 2 points. And then you have baby's movement, and that's another 2 points. After you've seen baby breathe for a minimum of 30 seconds, you should, at this point, should have met all the requirements. So the baby should have a score of 8 out of 8. That's with the fluid, the breathing, the flexion, and the tone, okay? There's also another part to the BPP, which is where the nurse will do a non-stress test. This is gonna be like measuring heart's reaction, baby's heart reaction, okay? But with every exam that I do, I always check the baby's heart. We wanna know if the baby, how many beats per minute baby's heart is going, because it can be a determining factor, or not a determining factor. It can tell you whether or not the baby's in distress, or maybe the baby's not gonna make it, or if the baby's it has other kind of issues going on. The heart rate is very important, so I always check that. But the stress test is another 2 points. So without doing the non-stress test, the baby should have an 8 out of an 8. With the stress test, they should have a 10 out of a 10, okay? The less requirements that baby meets, unfortunately, the less likely this baby is gonna be healthy or gonna make it. I don't know how to put that to be gentle. But so already I've already talked to you about the growth scan and then the BPP. I've also done the cervical length screening. What that means is you basically, up until, I wanna say, depending on what the doctor says, but I wanna say it's up to like 32 weeks, you will check if the doctor wants you to, for certain pregnancies, we'll have you check the cervix, make sure there's no funneling or opening or shortening of the cervix. And then for other pregnancies that are not needing to have a follow-up of the cervical length every week or whenever they come in, we basically will test it once, and it's typically within their first trimester. up to 26 weeks, I believe. Anyhow, you basically will take the transvaginal probe. You will insert it as if you were doing any other transvaginal exam, but you don't want to put too much pressure because it can falsely lengthen the cervix. So you want to have equal parts of the cervix on the screen, and then at that point you will measure it. Basically, like I said, you're just measuring, making sure that cervix is not opening, shortening, or that there's nothing blocking the os, the inner os, okay? What I mean by anything blocking it, you don't want baby's cord within the funnel if it's funneling. You don't want any placenta being in it or near the internal os. So that's the kind of stuff that we're looking for when we're doing those cervical screenings. So I've done those, growth, BPP. I've just recently started doing anatomy, and let me tell you, I can get most of the way through the anatomy scan, but chasing those babies, you gotta be fast, because you can't tell the baby what to do. You just can't. So you just gotta, as soon as you see it, you have to freeze it and scroll back, or just go ahead and take that picture. You've got to catch it, because at this point, when you're doing anatomy screening, you're looking at everything from brain, you're also doing the growth, you're doing the fluids scan, you're making sure baby has both legs. That's including the femur, tibia, and fibula, the humerus, the ulna, and the radial bones, okay? You're also making sure that baby's heart and stomach are on the left side, and then you're checking, you know, fetal echoes. You're making sure they have all 10 toes, all 10 fingers, making sure that they don't have club feet, that they do have a nasal bone present. Also making sure that there's no nuchal thickening in the back of the neck. So an anatomy scan is a lengthy exam, very lengthy exam, especially if you have multiples. So if you have twins, you're doing everything that you would do on a single baby on all babies. If you have triplets, same thing. But when you're doing multiples, you are documenting where these babies are, so that way you know you're following the same baby each time. And you definitely want to keep notes for each and every sonographer on that patient's chart, so if another sonographer scans that patient, they can follow the same, they know which baby's which. So definitely make notes for your fellow sonographers. That basically is the extent of where I've gone. I have not done any fetal echoes yet. I'm a little bit intimidated by that, I'm not gonna lie. I'm sure once I'm a little more confident in scanning everything, probably by the time that I finally get an anatomy scan down is probably when I'll be ready for fetal echo. Not gonna lie. But yeah, it's definitely really intimidating. But that's how our day goes. Depending on how many sonographers are staffed for that day and how busy our schedule is, I will typically see about 6 patients a day, which is completely different from the hospital side. On the hospital side, some days you may only see like 1 or 2 patients, but then some days you will be non-stop. Go, go, go. There's been days where I've seen 16 patients, and I'm telling you, after a 12-hour shift and seeing 16 patients, I am donezo. Like, I just want to go home and go to sleep. So the clinic is really different in that regard, but our exams are much longer and lengthier, and we have to definitely have a poker face, because you want to be happy when you're doing these exams for these expecting parents, because having a baby should be a happy time, and unfortunately not every one of them is. So you're in there and you're telling them all the good stuff, and you're talking to the patient, and you don't want to sit too long trying to scan something or looking for something, because then that parent will start to get nervous and wonder if everything's okay. So you definitely want to reassure them throughout the exam that everything is going to be okay, that the baby's doing everything it needs to be, and so on and so forth. I have yet to have a fetal demise in the clinic. I've had it on the hospital side, but the fetal demise that I've had, I've never actually seen. Like, I've had one, It was really sad, but it was an early pregnancy. Not that it makes it any easier for the family, but for me, it made it a little bit easier. I am not looking forward to the time that I'm gonna have, because it's not if it happens, it's when it happens. I'm not looking forward to it, but it is a part of the job. And I've even asked the question, if I don't find a heartbeat, do I tell that patient? And yeah, I do. At that point, I have to say, hey, I'm unable to get a heartbeat, and I'm gonna finish this exam. So basically, if it were me, I would assume that I'd go ahead and finish the exam and then get that heartbeat and take it a couple times and let that patient know, I need to step out and go get the doctor. And hopefully the doctor will come in and tell the patient. But sometimes, unfortunately, the patients are a lot smarter than what we think, because they've had so many ultrasounds and they see what's going on. They know what they're expecting, and unfortunately they'll ask us and we're gonna have to tell them. So I really dread the day that I have to do that. But it's a part of my job, and I will definitely take on each task that I have to in order to do the best that I can at my job. But I just kind of wanted to jump on here and talk to you about how things have been going in the clinic. Let me tell you, the girls that I work with, we have one guy that we work with too, but everybody that I work with, I absolutely enjoy working with each and every one of them. They're super sweet. They've kind of taken me under their wing. They've taught me everything. There's no dumb question to them. So it's really it's just in the month that I've been there, I feel like it's like a really tight family per se. So it's nice to be around good people, especially when you have to work with them all the time. So anyways, I hope this video was informative, and I hope I didn't trip up on my words too much. But yeah, I hope you have a wonderful day, and we'll look forward to the next video. Bye guys.